Hello everyone and welcome to today's webinar sponsored by Bisco. I'm Greta Liskey from Dental Products Report, and today I'm happy to introduce our speaker, Dr. Adamo Notarantonio, who will discuss the inner workings of Bisco's All-Bond Universal. Throughout the presentation, he will explain the indications for use of All-Bond Universal, unique features, elements of its chemistry, and he'll also take you through two specific case studies using the product. Doctor, take it away.
Thank you very much. As was mentioned, we are having a webinar today, the topic being All-Bond Universal. As we know, universal bonding agents are the newest fad in dentistry, and many have come out, and all bonding agents are very, very popular. So the question is, why am I discussing All-Bond Universal, and why do I use this product in the office? This product is manufactured by Bisco, and it's probably been out, I would say, a little over a year. I've been using it in the office for about a year and a half, beta tested the product as well. We're going to discuss the benefits of All-Bond Universal in comparison to other bonding agents out there at this point, and discuss how it can fit and why it's a good mix and fit for your office. So, first up, we're going to discuss the indications for use of this product. And as you can see from the slide in front of you, there are many indications and uses for All-Bond Universal. It can be used for all direct restorations, indirect restorations, intraoral repairs, desensitizing and sealing teeth, and as a protective varnish for glass ionomer-based fillings. Later in the presentation, you will see All-Bond Universal used in a couple different ways, and that's one of the main reasons why I like, enjoy, and use this product, is I can have one bonding agent for many different reasons rather than stock a different bottle for every material that I need. Some of the unique features and benefits of All-Bond Universal include your flexibility of technique. I'm in an office with 4 other doctors, and obviously all our techniques are not the same. Some choose total etching, some self-etching, and some selective etching. This one bottle gives us the versatility for everyone to use whatever technique they deem fit, not only for every restoration or every type of thing they do, but they may choose one type of technique for one reason or one restoration and choose a different technique for another, and that gives us a little bit of flexibility with this material in itself. You can use this for both direct and indirect restorations. Before switching to this product, as an office of the size that I have, there were so many different bonding agents, cements, materials, and inventory in stock was very, very difficult. With this one bonding agent in one bottle, it makes for organizing, ordering, and everything else much, much more simple. As you'll see later in some of the slides and the research on this material, it exhibits very high bond strengths to indirect substrates, including metals, glass, ceramic, zirconia, aluminum, porcelain, and the lithium disilicate material that is pretty much one of the other new crazes in dentistry of the recent time. Finally, it's designed to be fully compatible with not only light-cured materials, but self-cured and dual-cure composite and luting cements as well. Some other unique features and benefits of All-Bond Universal include a very low film thickness as compared to some of the other universal bonding agents that I've seen, where the material is a bit more viscous and thick. All-Bond Universal is very, very thin, which makes me much more comfortable when using it with indirect restorations. One of the biggest reasons that I like All-Bond Universal is that it requires no additional activator when being used with dual-cured cements and materials. All of the other universal bonding agents out there at this point, if they're going to be used with a dual-cure material, do require an additional activator. So that would require a separate bottle, and the two materials would need to be mixed. All-Bond Universal, on the other hand, does not. The activator is already in the material, so that allows it to be compatible with not only light-cured but dual-cure material as well. Another feature and benefit is there is no refrigeration needed. It can be stored at room temperature. It's got a shelf life of approximately 18 months. And as you can see here from the technique card, whether using for direct or indirect tooth preparations, there are 3 different techniques that can be utilized. On the left, we see a self-etching technique. In the center, total etching technique. And on the right, a selective etching technique. So this leaves the provider a couple different options depending on what type of restoration or what type of preparation, what type of material he's cementing to or she's cementing to, whether or not they want to use a self-etch, total etch, or selective etch. And again, like I mentioned before, with multiple doctors, this comes in handy because every doctor and every situation is not the same, so we have different options to use with one bottle. One question asked about all of these universal bonding agents on the market today is All Bond Universal a true universal, and are all the other ones a true universal as well? As you can see from the slide in front of you, we have a comparison sheet of All Bond Universal with Scotch Bond Universal, OptiBond XTR by CORE, Surpass by Apex, Clearfill, SE Protect, and Brush and Bond by Parkel. In terms of whether or not it can be used for total etch and self-etch, as you can see, the 3 that are available are All Bond, Scotch Bond, Brush and Bond. And if you notice, without me going into every column and every answer, you can see that the only bonding agent that has checks in every department is All Bond Universal. Again, as we mentioned before, some are not compatible with dual cure and so on and so forth. So for pretty much any type of restoration, you can count on All Bond Universal for whatever application that you decide to use. Some technical information about it, and I won't bore everybody with chemistry because I wasn't very good at it, but I do understand it now a bit when it comes to bonding agents. This is just a quick overview of what we're going to discuss. I picked and choose a couple that I felt were important so that we didn't run over time, and we showed some case presentations as well. So as you can see here from the product description, All Bond Universal is a combination of a self-etch product, total etch product. It has your resin layer, so you don't need an additional resin layer, and the activators included. So it's compatible, as I mentioned before, with all self-cure and dual-cure resin materials. The chemistry of current self-etch adhesives are, most of them are incompatible with self-cure materials, as I mentioned before, because they require a separate activator. They're also incompatible because of their acidity and permeability. They're a little bit more acidic than All Bond Universal is, as you're going to see in a minute. All right, so if they're permeable, which means they're too hydrophilic and they like water, the dental fluid can break them down. You'll get faster degradation due to hydrolysis. It doesn't seal dentin very well, which can lead to possible sensitivity, and obviously would be incompatible with slow curing or self-curing materials. All Bond is less hydrophilic, it's more hydrophobic, and the cured adhesive is less permeable, which are 2 things that we want when we're talking about a universal adhesive. Their self-etch mode has very high bond strength, and as mentioned before, because of the activator that's already in the product, they're compatible with slow curing or self-curing materials. And you can see here in the water drop test on the left side, uncured All Bond Universal is very hydrophilic, which is very good when it comes to the bonding and the priming part. And once it's cured, it becomes very hydrophobic, which allows it to be less permeable, gives us a better seal, less chance for us to get sensitivity, and allows it to be compatible with both self-cure and dual-cure materials. And the study done by Bisco, this shows the bond strengths on 3 different types of dentin. One that was completely desiccated, one that was moist, and one that was over wet. And as we can see, the bond strengths are pretty high and pretty within each other's range. And what does that tell us? That it doesn't matter what surface you apply All Bond to, whether it's dry or wet, depending on the type of bonding technique that you like to use, you're going to get a good bond strength to the substrate that you're bonding to. In summary, at this very moment, All Bond Universal is the only true universal one-bottle dental adhesive. It does bond to all dental substrates, direct or indirect. As mentioned before, it can be used with self-etch, total etch, or selective etch techniques. It's hydrophilic, which allows it to be a good wetting agent before curing, but after curing it becomes more hydrophobic, allowing it to be non-permeable and durable as compared to other adhesives. With that in mind, it's a long-lasting and it gives you a very durable bond strength. You don't need an additional resin or adhesive layer, as you may in other systems. It bonds to dentin very well regardless of the moisture level, whether it's over wet, moist, or dry. It's compatible with self-cure, dual-cure resin materials, and does not require an additional activator. Doesn't need refrigeration, and the solvent is easily evaporated, as mentioned before, as I talked about the viscosity of this material as compared to others out there. And one thing that's not on here that I did mention before as well, it makes ordering and it makes inventory and stock very, very convenient, especially in a multi-practitioner practice like the one that I am in, so that not every doctor has a different bonding agent and a bonding system for themselves, that we all can use one universal bonding agent regardless of the technique that we choose to use when we bond. With that in mind, I'm going to go through a couple of quick examples and show you the versatility of All Bond Universal as a product itself. And the first one I'll begin with is a very simple core buildup and crown. So we have a patient who presented following root canal therapy with an existing composite onlay on tooth number 19. The endodontist accessed right through the occlusal and completed the root canal there. Patient returned with a temporary filling and cotton underneath that. Now, anytime I'm doing any type of bonding or adhesive dentistry, I try my very hardest. 99.9% of the time, I would say, I use rubber dam isolation. Now, the case I'm going to show at the end of this webinar, unfortunately, I could not get a rubber dam on tooth number 8. We'll discuss why shortly. So I isolate properly with my rubber dam, and I'm going to remove my cotton and temp it. And at that point, I decide whether or not I need a post. I try my very hardest to not put posts in if I don't have to, because we know that posts are there just to retain a core material, but you guys can see from this access and preparation that I have plenty of tooth structure to retain my core. The material I'm going to choose is called CORE-FLOT DC. That's also by Bisco. We'll discuss why a little shortly down the road. In this case, I'm going to use a total etch technique, and the reason I chose that is because the tooth is non-vital and I'm not really worried about sensitivity. So I apply my etch and I leave it there for 20 seconds. And you notice here that I only use water and not the air-water combination when I am rinsing off my etchant. I don't want air to over-dry the tooth and desiccate the collagen in the dentin, so that I wouldn't get as good of a bond as I could. Okay, so I just run the water, rinse that for 15 to 20 seconds, and then in order to dry the tooth, I take a cotton pellet and I dry it with a cotton pellet to avoid desiccating it. I then apply my All Bond Universal with a microbrush, and the best way to do this is very simple. Read the directions. I wasn't always one to do that in life, but now I do. The scientists and the chemists behind this have done endless testing and come up with the best ways to work this product. So now anytime I'm using whatever material it is, I always read the directions, because there's a reason they tell us how many coats for how long and what to do after we apply what we do. So after I apply my All Bond Universal, I air thin it as recommended by the manufacturer, and then I light cure it. And at that point, I'm going to apply my core buildup material. And you can see from the slide I have chosen a natural color. And the product, as I mentioned before, is CORE-FLOT DC by Bisco. Now, the question is, why did I choose this? The main reason I chose this core buildup material is because it is dual cured. Okay, and this allows me to ensure myself that all the material will be cured after whatever setting time that the company recommends the material sit for the dual cure to be complete. And I believe off the top of my head, it's 7 minutes for Bisco's CORE-FLOT material. And this just makes me feel a little more comfortable when I have deep cores and areas that maybe the light may not be able to access, that the material will be cured on its own. CORE-FLOT DC comes in 3 different colors. We have natural, which is the one I probably use the most, opaque white, and then blue. The blue material actually will just give you a good contrast to the 2 structures, so in case you need to go back in and remove anything at some point, it's very easy to find, obviously, that material. You can see from the x-ray here, it's got good radio opacity, which is another important thing. The film thickness is about 25 microns, which allows it to be pretty flowable, but also has a bit of body to it, so I can maneuver it a little bit. And you can see here, this is the core completed and adjusted with the rubber dam still in place. So once the core material is cured completely and I'm ready to begin my preparation, the first thing we do here, and actually the first thing I do before I start to prepare the tooth, is I decide what material I'm going to use for my final restoration. And in this case, I chose lithium disilicate, or EMAX. With that in mind, I need to decide how much occlusal reduction I'm going to need for that type of restoration. And in that case, the recommendations for lithium disilicate in the central fissure are between 1.5 and 2 millimeters. So these 3 potholes you see are holes made by a reduction burr. And the reduction burr that I choose is by a company called Cometis. And basically what it has is a stopper on it, and that ensures me that I'm 2 millimeters down into the central fissure. At that point, I will just reduce the rest of the occlusal area down 2 millimeters, and I know that I have the adequate reduction I need for the restoration I chose. After that, I complete my preparation, and again, being that it's an all-ceramic restoration, I chose a chamfer preparation with an axial wall depth of minimal 1 to 1.5 millimeters. Once my preparation is complete, I'm going to isolate before my impression, and in this case I used X-Bacil because the restoration was not very subgingival at all, and I didn't need to retract the tissue too far. The X-Bacil is put in place. I have the patient bite on a copper cap, and I leave it there for about 3 minutes so that it sets and expands the tissue away, leaving me a very visible margin for my preparation. Once the crown comes back, I actually treat the internal surface of the crown myself, and whatever the manufacturer directions are. For lithium disilicate, it's about 20 to 30 seconds of porcelain etch or hydrofluoric acid, rinse it dry, and apply a porcelain primer. I do that before I try the crown in, because once the primer is applied, there's a bit of a seal over it, so after I try it in, whatever I get on it, I can easily clean by either putting the crown in an ultrasonic solution, most of the time ethanol, for about 2 minutes, or scrubbing the inside with phosphoric acid and rinsing it, drying it that way. After this is done once, I don't need to re-etch and prime the restoration before I insert it. And then, according to the manufacturer's instructions, I treat the tooth substrate the way it's recommended for using All-Bond Universal, and I use Bisco's Dual Link Universal Resin Luting Cement. And you can see from the picture up here on the left, the etch is applied, it's rinsed and dried, and then on the bottom here, we apply our All-Bond Universal, air thin it, light cure it, and then we put the cement in the crown, seat it, and once it's seated, I just tack cure the cement till it gets like a gelatin, and I can peel it off and around the margins and through the contacts very quickly prior to final curing. I can go ahead and try to cure it completely, and being that it's a dual cure cement, whatever light does not penetrate my cement, the cement will cure itself over time. You can see the cement is here. This is right when I tack cure it. See, it's pretty stable at that point, and then I just peel it away from the margins. I can see some cement interproximally, so I make sure I go in there with floss, Explorer, whatever I need to clean that all up. And like with every crown or onlay or inlay that I insert, I always take a post-op bite wing for two reasons. Number one, I want to make sure that my margins are sealed so that I find the open margin and not the next dentist that they go to. Or if I have excess cement, like you can see on the mesial here, I have a cement tag right here. So I easily go back in there with floss or a scaler and clean that up and make sure there's no excess cement. The next section of this webinar, we're going to continue with All Bond, but we're going to introduce another product called Theracal. And this patient presented to me and called the front desk and spoke to his sister who works for me at the front to tell her that he wanted to see me so I can patch up the hole in his front tooth with some bonding. Unfortunately, what he didn't realize is he has an enormous cavity in tooth number 8 and a pretty decent one, as you can see in this photo, on the lingual of number 9 as well. With photographs and radiographs, we show the patient the size and the extent of the carious lesion in both teeth, informing him that there is a possibility that tooth number 8 may require root canal because the decay was extensive and pretty deep. So we got the patient numb, and as I mentioned before, unfortunately, the minute I put the rubber dam on, he became very claustrophobic and begged me to rip the thing off. As much as I don't like to do that, and I prefer to have a rubber dam with any bonded restoration that I do, I respected his wishes and took the rubber dam off, mainly because it was an anterior tooth and I felt that with cotton roll isolation and suction we would be okay. As you can see in this slide, all the decay has been excavated, and I placed a bevel in a starburst fashion, which I'll explain why in a little bit, on the facial surface here. As I mentioned, the decay was very, very deep and pretty much almost into the pulp. I then chose to lay down a pulp protectant or a liner, and the material I chose was Theracal LC for light cure, which is a resin-modified calcium silicate material. And what this is designed to do is to perform a barrier and protect the pulp, the same way something like calcium hydroxide or resin-modified glass ionomer materials would do. All right. Some of the indications for use for Theracal are for direct pulp capping. We fortunately did not have an exposure, but this material is good for direct pulp capping when having carious exposures or mechanical exposures or exposures due to trauma. In this case, we did an indirect pulp cap under a composite, but it can be used under other materials such as amalgam or under other base materials as well. And it's basically used as an alternative to calcium hydroxides, glass ionomers, or cavity varnishes as mentioned previously. Calcium release, as we know, it affects mechanical sealing of the pulp, hydroxyapatite formation, and it does help in secondary bridge formation as well. It's moisture tolerant, which in this case was good because we weren't able to get a rubber dam on him, although we had pretty good isolation. And here are the technique cards for Theracal. And the technique cards show you both techniques for a direct pulp cap, which you'd see on the left, or an indirect pulp cap, as you'll see on the right. You can see from this photograph, from this view, that the Theracal was placed in a majority of the dentin and over the deep carious lesion after the caries was removed. And again, you can see from this picture here a little more clear the bevel that was placed, and this will allow me to blend the composite up the facial surface to avoid seeing any distinct line between resin and natural tooth. After the Theracal is applied and light cured, and this material was light cured for about 20 seconds as recommended by the manufacturer. In this case, I chose a selective etch technique in which I etched the enamel only, and to the adjacent tooth I used Teflon tape to avoid bonding to the adjacent tooth and to allow me to have a nice tight contact. I like the Teflon tape better than Mylar strips. Sometimes with the strips I feel they're a bit too thick, and when I remove them I have a little bit of a light contact, in some cases an open contact. So the Teflon tape really works well in my hands. If it's a technique you haven't tried, it's something I definitely recommend, especially for anterior restorations. So I apply the All Bond, again, as per instruction, and light cure it as well. The first layer of composite that I laid down, and in this case I used Empress Direct Composite by Ivoclar, and with the shade we chose, I believe was A3. I place an enamel layer on the lingual and light cure that. Following that, I place a layer of A3 dentin, and in this case, you can't see it right now because the Teflon tape covers it, but as you can see in this area right here, I added some orange tints to mimic the tooth adjacent to it. After that material is light cured, I go ahead and cover the rest of the remaining surface with the enamel shade A3 of Empress Direct Composite as well, and cure that. Once all the composite's placed and light cured, I'll begin to start to shape the tooth after removing the Teflon tape next to it. And once it's pretty much in the ballpark of the shape that I prefer, I'll take a close look at the composite, not only visually, but I will bring this photo back up on to my computer screen in the office to see if I can see the line between the tooth and the resin, if the tooth has the proper characteristics in the incisal area, or if I need to go back and make any more adjustments. And in this case, I was pretty happy with the blending of it, although I did see a little bit of a line here and felt that I had a little too much white and opaque here. So I removed some of the composite, went back, retreated the surface, and made adjustments as needed here by adding a little more of the orange tint seen in the natural tooth and another layer of composite over that. I'll go ahead and reshape that again once I'm done. And you can see here from the final product, we had a really, really nice blend. And this is prior to polishing. Again, I just wanted to make sure that all my characteristics were where I want. And I was able to add some nice characteristics here in the incisal third to mimic natural tooth number 9. And following polishing, I'll take a real close-up photo. And yes, I know in this view, you definitely can see a little bit of a line here. But from a distance and to the naked eye, it was pretty much a seamless blend of composite. And we have pretty much the same surface characteristic on the natural tooth as we do the composite. So I was pretty happy with the end result of this. And you can see here from before and after, we've pretty much restored the natural lifelike characteristic of tooth number 8. Once the decay was excavated, we were able to put Theracal down as a liner to hopefully help us avoid any root canal treatment in the future. And from my experience over the last year or two with Theracal, I've gotten some great results and been able to avoid some root canals that I thought were a sure thing with this material. We had a real happy patient and a really, really nice result, not only aesthetically, but functionally as well, again, to help the patient avoid root canal, post, crown, or whatever else would have been needed on this tooth to restore its natural appearance.